Welcome to the Varenicline webinar for the City of London and Hackney pharmacists. You should have already read the September 2017 version of the PGD before watching this webinar. My name is Marilyn Nathan Wilson, the Chief Pharmacist for WDP, which stands for Westminster Drug Project. As the Smoking Cessation Lead for the City of London, I manage the Level 2 and Level 3 services. The brand name for Varenicline is also known as Champix. From now on, I'll be referring to it as Champix. This presentation will enable pharmacists working in both the City of London and Hackney to provide Champix using the patient group directions approved for use by the City of London Public Health and Hackney Public Health. It's important you have your printed copy of the September 2017 version of the PGD with you, as you'll need to refer to it throughout this training session. Now, Champix is a prescription-only medicine, and it's indicated for smoking cessation in adults. It can only be given out by a doctor on a prescription or a pharmacist who's been trained on a patient group direction. Now, I'm first going to talk about the reading list, which you must complete as well as part of your PGD training. The first required source you must complete is the patient group direction document you have now, the EAGLE study, which should be found on the Pfizer professional website. You need to register as a healthcare professional, and once you're registered, you should have access to the EAGLE study. And then also the Champix summary of product characteristics. This information can also be found under www.medicines.org.uk EMC. After this, I'm going to talk about how Champix works. Then I'll cover the content of the PGD. Then I'll touch on the EAGLE study. Once you complete the session, please ensure you complete the workbook as well. Now, the required sources. Now, all pharmacists providing Champix on PGD would need access to the BNF, the latest edition, and also information about services involved in providing healthy lifestyles. All members of staff working in your pharmacy must be aware of how Champix is provided in your pharmacy. This can be either given to them by a standard operating procedure or a Champix protocol, but it's essential every pharmacy providing the service should have a Champix protocol or a standard operating procedure in the pharmacy. Service specifications for premises. Now, pharmacies providing the service must meet the following requirements. All pharmacies must be located within the City of London and Hackney boundaries. Service provision should be carried out in a private consultation room which meets standard contractual requirements. And the pharmacy must have access to Pharm Outcomes, that's if you're in the City of London, and Sonar, that's if you're in Hackney. Now, this is required to record the data and also to claim reimbursement. Now, all pharmacy staff must also have access to information on all pharmacies which have been accredited to deliver the stop smoking service in their relevant area. Now, this is to ensure that in the event of any unexpected absence by an accredited pharmacist, clients can actually be referred on appropriately to another pharmacy. The pharmacy owner must notify the authority, that is the City of London or Hackney's smoking cessation team, of any planned changes to service opening times. The pharmacy owner must also notify the authority if an accredited pharmacist leaves or moves, or where the pharmacy closes or relocates. Now, the pharmacists, our professional requirements. The pharmacist must be fully registered with the General Pharmaceutical Council And the pharmacist, you must be compliant with the Equality Act 2010. And you must also be registered with the Centre for Pharmacy Postgraduate Education, which is also known as the CPPE. Now, once you've finished the PGD training, you would have to sign the last document, that's a declaration of competence, and send it to either Donna Lee for the Hackney pharmacists and myself, Marilyn Nathan Wilson, for the City of London pharmacists, and also keep a copy in your pharmacy as well. Now, Champix. How does Champix work? The way Champix works is it binds with a high affinity and selectivity at the alpha-4 beta-2 nicotinic acetylcholine receptors. Now, at these receptors, it acts as a partial agonist, which is a compound with both agonist activity with lower intrinsic efficacy than nicotine, and also an antagonist activity in the presence of nicotine. So, as a partial agonist, it can actually activate the nicotine receptors only slightly because it has a lower intrinsic efficacy. But as an antagonist, it actually has a higher affinity for the nicotine receptors, so then it actually blocks the nicotine receptors effectively. Now, this diagram actually shows how Champix acts in the presence when someone smokes. Diagram 1 shows when someone smokes, the nicotine receptors are activated and we have dopamine release, which I'll talk a little bit more about that later. You can either go cold turkey, don't smoke at all, or if you use Champix, what Champix will do is Champix will bind to the nicotine receptors and prevent nicotine from binding, yet because it's an agonist, it will just slightly stimulate dopamine release. So this enables our clients to actually manage their withdrawal symptoms a little bit much better. As I've mentioned before, Champix effectively blocks the nicotine ability to fully activate the alpha-4 and the beta-2 receptors. Now, what that means is the mesolimbic dopamine system, which is the reward pathway, doesn't get stimulated as much. Now, this next diagram actually shows the development of nicotine dependence. The picture on the left shows when a smoker smokes nicotine, it's taken up very rapidly into the brain, and it releases dopamine, which activates the reward pathway, the mesolimbic pathway. This produces an euphoric feeling of calmness, pleasure, and after a while, these dopamine levels decrease quickly and the smoker starts experiencing withdrawal symptoms, which could lead to irritability or restlessness. Now, this encourages the smoker to want to smoke again. Now, the diagram on the right, it shows Champix preventing the nicotine from binding to the brain. This means the patient doesn't get the full reward of smoking. So this is another way Champix can actually encourage abstinence. It will reduce cravings and it would actually make withdrawals much more bearable, therefore making quitting more achievable. Now, in general, it's a good idea to have a rough idea of the absorption of Champix. Champix, you normally get blood levels rising about normally 3 to 4 hours after oral administration. And the oral bioavailability of Champix is actually unaffected by food or any time of day dosing. So you can take it any time, but normally it's better to take it as prescribed. Biotransformation. Normally, Champix actually undergoes minimal metabolism, and by that I mean 92% is actually excreted unchanged in urine, and less than 10% excreted as metabolites. In vitro studies actually show that Champix doesn't inhibit or induce any cytochrome P450 enzymes. So what that means is Champix doesn't actually alter the pharmacokinetics of any compounds which are actually metabolized by those enzymes. Elimination. It takes about 24 hours for Champix to be eliminated from our system. So the elimination half-life of Champix is approximately about 24 hours. Now the PGD. As I've mentioned before, one essential is the standard operating procedure, which must be written by the retail pharmacy to ensure it covers the practice in that pharmacy, but then also the professional indemnity. You must ensure there's professional indemnity cover in place, either provided by the NPA, that's the National Pharmaceutical Association, the Pharmaceutical Defense Association, which is the PDA, or another reputable organization. They must all confirm that providing Champix with PGD is actually included in their policy. Now, who can you give Champix to? Who's included under this PGD? Any adult over 18 who's actually set a quit date, that means they're actually motivated to quit. Anyone living, working or studying in the City of London and Hackney can be given Champix. And very importantly, we must take a medical history and document it to establish that there are no contraindications to that patient for the treatment of Champix, or no other cautions for that particular patient. In addition, we must ensure that the patient agrees to receive behavioral support according to an agreed protocol, because Champix is not given as a standalone therapy. It's given with behavioral therapy as well. Exclusion criteria. We cannot supply Champix to clients who are not sufficiently motivated to quit, or clients who have had a reaction to Champix or any of the excipients in the medicine. Anyone under 18 we cannot supply Champix to, or if someone's breastfeeding or pregnant. Clients with end-stage renal disease cannot be given Champix, or a client who doesn't consent to GP involvement, they cannot receive Champix either. Now, under this PGD, you cannot supply Champix in combination with other smoking cessation products like nicotine replacement patches or nicotine replacement gum, or buprenorphine, which is Zyban. As pharmacists, we're all bound by guidelines in the Code of Ethics, so you must make sure you maintain your client's confidentiality, privacy, and dignity at all times. And you must also ensure that their details are not disclosed to any third party without the client's consent. The cautions under this PGD. I mentioned I was going to talk about the EAGLE study, but the EAGLE study has actually changed the way we treat patients with a history of psychiatric illnesses. We can actually now supply to patients who have a history of psychiatric illnesses, but we must ensure that at every appointment we ask about their mood, how they're feeling, if they have any changes in their emotions, or any behavioral changes they feel we should know about. We must ask and record that on farm outcomes and SONA. Now, if a client develops any suicidal thoughts or behavior, they will be told to stop treatment. You must tell them to stop treatment and contact their GP immediately. Or if any of their family members or caregivers have concerns about agitation or depressed mood or changes in behavior of the client, Champix has to be stopped immediately as well. Now, clients who have a history of cardiovascular diseases. Now, if you're not sure about their cardiovascular status, refer them to the GP for clinical advice. And if they suffer from unstable cardiovascular disease, please refer them to their GP. Clients with histories of seizures or conditions which can potentially lower the seizure threshold, you must treat them with caution. Any client who has also developed a significant side effect or a reaction, for instance, a rash or a skin reaction to Champix, it's not a good idea to try Champix again with this patient. Clients who also have severe renal impairment or mild or moderate, dose adjustments are actually recommended. So you should actually approach elderly patients with caution. Yeah. Now, there are no clinically significant drug interactions which have been reported for Champix. However, we must make sure we observe patients who are on other medication that I'm actually going to mention later on in the session. Now, Champix, how is it supplied? Champix comes in two forms, the white tablet and the blue tablet. That's what you're going to hear from patients. The white tablet is the 0.5 milligram and the blue tablet is the 1 milligram. I've explained this slide a little bit more in the next slide. When a client decides to give up smoking and they've set a quit date, they're allowed to start Champix 14 days before their quit date. So on day 1 to 3, they can take 0.5 milligrams once daily. Day 4 to 7, they can take 0.5 milligrams twice daily. Then day 8, right to the end of the treatment, which is 12 weeks, they can take 1 milligram twice daily. Sometimes some clients can't tolerate the adverse effects of Champix, so we can actually lower it down to 0.5 milligrams twice daily. Now, if a patient experiences any of the reactions I mentioned before, the rash, the cardiovascular, the change in mood, please make sure they discontinue the treatment and they seek medical advice immediately. The side effects of Champix. The normal side effects are normally nausea, headaches. Some patients actually experience abnormal dreams and lack of sleep as well. Insomnia happens earlier on in the treatment. Please make sure you warn the patient about these and assure them that it won't be right through the 12 weeks. There's some also common side effects which I've mentioned over here with the dry mouth. You might have a bit of GI disturbance, like I mentioned, nausea. Slight shortness of breath sometimes, or maybe a slight cough. But if they're concerned about anything, encourage them to mention any slight side effects they're not comfortable with, and then help them manage the side effects. Drug interactions. As I mentioned before, Champix doesn't interact with other medication. However, it's actually smoking which actually induces an enzyme which actually metabolizes some of these drugs which are affected. Now, the levels of some of these drugs taken by a client once smoking is stopped may be affected. So we need to monitor these clients very closely. Examples of these drugs include clozapine, insulin, theophylline, and warfarin. With theophylline, for instance, smoking cessation reduces the metabolism. So what that would mean is the dose of theophylline would increase. So we need to reduce theophylline to make sure we can prevent toxicity, because it does have a narrow therapeutic window index. Warfarin. Smoking cessation can actually increase INR levels, and this could lead to bleeding. So we do need to actually reduce the dose of warfarin to prevent bleeding. Insulin. Now, smoking cessation actually reduces insulin resistance. Therefore, we would need to actually reduce the dose to make sure we maintain adequate blood glucose levels and prevent hypoglycemia. Now, when a client comes in to give up Champix, to give up with Champix, we need to make sure their expectations are managed. We need to make sure our clients know Champix is not a magic cure. We do need them to put a little bit of effort and determination. Champix is not going to remove all temptation to smoke, but it does make abstinence a little bit easier. So it takes the edge off just a little. We need to also assure them that Champix is safe. So if they do experience side effects, which is normally a little bit disturbing, for instance, nausea, help them manage it by telling them, have it with food, or make sure you don't take it on an empty stomach. Same thing. But help them manage the side effects, that they don't stop attempting to stop smoking. Now, when a patient starts Champix, we need to make sure that we complete the documentation listed here. Very importantly, the form and the strength of the dose you've agreed, the batch number and the expiry date. All this information must be included on SONA or Farm Outcomes. And in the first week, we need to make sure we see the patient every week. After that, we can see them fortnightly if they wish. As I've mentioned before, you do need to make sure you inform the patient's GP, client's GP, within 2 working days. It's very important, due to the drug interactions I've mentioned, that the client's GP is informed within 2 days of starting. The EAGLE study. Champix is not associated with a significantly increased risk of adverse effect in smokers with psychiatric disorders and in smokers without. So the study that was carried out was with about 8,000 patients, and it was divided into 2 different cohorts, different groups. And one group was smokers with a history of psychiatric disorders, and the other group was smokers with no psychiatric disorders. And the results of the study actually showed there was no difference in the adverse effects experienced by these 2 groups of patients. Now, this completes the webinar. Please ensure you complete the workbook, and please ensure you sign the declaration to say you've completed the workbook and you've completed the webinar. Once you've done this, send the signed declaration to myself for City of London Pharmacists and to Donna for Hackney Pharmacists. You'll receive your results of your workbook through me by email. Thank you.